Are mid-urethral slings at risk of extinction? I want to present you the ProDAM study, a prospective single-center study at AZ Groeninge Hospital at Kortrijk, Belgium. I have nothing to disclose. As you know, the transvaginal mesh for the treatment of prolapse has been completely banned over the last decade. The mid-urethral sling has suffered image damage and has been banned in various countries as well. One of the reasons to ban slings was the lack of prospective data that could offer a counterpart to the many, whether legitimate or not, complaints about complications. We created a prospective database. On one hand, patients were invited to complete validated questionnaires at systematic times. On the other hand, post-vote residual before operation and complications during operation and at 3 and 12 months were filled in by the treating physician. Most important patient characteristics can be found here. The majority of the procedures performed were TVTOs. It concerned a secondary sling in 11%. Simultaneous surgery was performed in 31% of patients, of which 63% cystocele repair. Success rate, which is a PGI of 1 or 2, was 88% at 3 months and decreased not significantly to 83% at 12 months. The IIQ-7 showed a significantly improved score at 3 months and remained stable at 12 months. According to the UD6, there is a significant improvement for overactive bladder complaints, for stress urinary incontinence related symptoms, and for obstructive symptoms both after 3 and 12 months. Preoperatively, 68% of women were satisfied with their sexual life, while after 1 year there was a significant improvement to 84%. For both pain and incontinence during sexual intercourse and fear of unwanted urine loss, we see a significant improvement after 3 and 12 months. At 3 months, 10% of patients had a urinary tract infection. There was 2% erosion, 3% retention, and 4% patients with pain. For these complications, 9 patients, which corresponds to 2.5%, underwent re-intervention. After 1 year, there were 4% asymptomatic erosions and 1.2% patients with persistent pain complaints. 3 factors appeared to have a significant impact on outcome at 3 months. Patients with simultaneous cystocele repair and patients with a higher preoperative post-void residual had a worse outcome at 3 months. However, the more stress urinary incontinence related complaints preoperatively, the better the outcome after 3 months. At 12 months, patients with a higher BMI and more urge complaints preoperatively had a worse outcome. To conclude, a large prospective sling database was created over 3 years, with 1 year of follow-up data in 59 to 72% of patients. Of course, there is still room for improvement here. Our center-specific data show a success rate of 83%, a 2.5% risk of re-intervention, and 1.2% risk of post-operative pain complaints. Currently, we are setting up a multicentric data collection based on broadly used hospital information systems in different hospitals in Belgium. Finally, long-term follow-up is definitely needed in the future. Thank you for your attention.